Next question from India, from Banjo Kaur, down to earth. Banjo, can you hear us?
Hi, can you hear me?
Yes, please go ahead.
Dr. Rayan, you must be aware that India, as part of its lockdown, is witnessing unprecedented humanitarian crisis in the form of movement of migrants from one part of the country to other. I do understand that you do not like commenting on individual countries, but this is an unprecedented humanitarian crisis. So what would be your advice to our government? And second question, it's not a question, it's just a clarification. None of the situation reports given by WHO says community transmission is happening in any of the countries, while we do know it is happening. So could you please clarify on that?
Can you just repeat the second part of your question?
I said the situation reports which WHO gives us every day, there are countries and the stage of transmission mentioned against those countries. Against none of the country there is mention of community transmission, while we do know that some countries are witnessing community transmission. So could you please clarify on that?
Yeah, I think we'll go back and look at our websites and see if the situation there. I don't believe we've indicated that there is no community transmission in somewhere like India, but we will definitely check that. But going back to, I think, what is the more important part of your question, which is the impact of lockdowns. Movement restrictions in any situation are very, number one, need to be taken very carefully, and two, obviously, regardless of their intent, are very difficult to accept by communities and by others, because people need to move and want to move for family reasons, for economic reasons, and for many other reasons. And it's important that governments communicate openly and transparently with their people as to the reasons why lockdowns or shutdowns or movement restrictions are occurring, because they do impinge on people's freedom of movement. And if people and communities are to offer up that freedom of movement, they do need to understand why that's happening. It's also, and those movement restrictions are regrettable in all situations. Nobody wants to see those happen. But in situations where you have a very, very intense epidemic in one part of a country and another part of a country it's not so intense, you may have to implement some measure to at least encourage. Sometimes it's advice, sometimes it's strong advice, and sometimes it's a restriction where transport is stopped. Each government has to choose the balance between what is advice to communities and what is in some senses an enforced lockdown. Whatever is chosen, it's really important that communication and acceptance by the community is at the centre of the concern of the government. It is impossible to have an effective restriction of movement without a community on board with that restriction of movement at all levels. And as the DG said in his speech, when such measures are put in place, it's exceptionally important that those measures are carried out with not only the acceptance, but with the human rights and dignity of the people affected at the centre. Now, that is not always easy, but that is what should be as part, at centre of the objective of the process. And I'm not here speaking specifically about India, I'm speaking about this in general terms. But I think what it does speak to is that these society-wide measures are difficult. They are not easy, and they are hurting people. But the alternative is even worse. And countries, if they're going to be able to move away from this approach of having to lock down and shut down, if we're going to move away from that approach as a means of suppressing the virus, we have got to put in place the public health surveillance, the isolation, the quarantine, the case finding, the detection. We have got to be able to show that we can go after the virus, because lockdowns alone will not work. But unfortunately, in some situations right now, they're the only measure that governments can actually take to slow down this virus. And that's unfortunate, but that is the reality. And we need to continually explain the reasons for this to our communities.
So, thank you. This is a very important question. Maybe on the first one, based on the transmission in countries, WHO has categorized actually countries into 4. There are countries with no cases, what we call the 4 Cs. No cases are a group of countries, and then the second is countries with sporadic cases, and the third is cases, countries with clusters of cases, and the fourth is community transmission. And we have now a number of countries with community transmission, and that's why we have developed a guideline that's tailored to these 4 situations. And please check our website and you will find the 4 Cs and the 4 categories and what should be done based on this. But we have community transmission in many countries, and we have said it many times. And then on the issue of lockdown, so-called lockdown, maybe some countries have already taken measures for physical distancing, closing schools and preventing gatherings and so on. That can buy time. But at the same time, each and every country actually differs. Some countries have strong social welfare system, and some countries don't. And I'm from Africa, as you know. And I know many people actually have to work every single day to win their daily bread. And governments should take this population into account, okay? If we're closing or if we're limiting movements, what is it going to happen to those people who have to work on daily basis and have to earn their bread on daily basis? So each and every country, based on its situation, should answer this question. We're not seeing it as an economic impact on a country, as an average of GDP loss or, the economic repercussions. We have to also see what it means to the individual in the street. And maybe I have said it many times, and I come from a poor family, and I know what it means to always, worry about your daily bread. And that has to be taken into account. Because each and every individual matters, and how each and every individual is affected by our actions has to be considered. And that's what we're saying. It's about any country. It's not about India. It's about any country on earth. Even the wealthiest country on earth can have people who need to work for their daily bread. No country is immune. Each and every country has to really make sure that this is taken into account.
Thank you very much.